Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Newman disease. Newman disease, we are looking at the types and the symptoms. So the first one is the type A. Type A is nothing but the first few months of life. It is seen in the first few months of life. It is abdominal belly area swelling within the 3 to 6 months. Then comes a cherry red spot in the eye, cherry red spot, and this is present in the eye, and the feeding difficulties as well as the loss of the early motor skills. Now we move on to the type B. Type B is late, it occurs late in childhood of the teenage age, and the abdominal swelling may occur in young childhood. So abdominal swelling is present, but it is in the young children. But previously in A it was in 3 to 6 months. Now there is almost no brain and nervous system involvement. So no nervous system which is involved, and there is a loss of motor skills. Some patients may have a repeated respiratory infection. So respiratory infections may be seen. Now we move on to the type C. So here in type C it is between the early infancy to the adulthood and difficulty moving the limbs. Difficulty in the limbs. Now how are the things? It is a spleen, it is enlarged. So there is enlargement. So what is enlarged? Enlargement of the spleen, enlargement of the liver. There can also be presence of jaundice. There is dementia, seizures, slurred, irregular speech. There is cataplexy. Next, there can also be tremors. There can be tremors, vertical, supranuclear, gaze, palsy, then ataxia. So how is type D? Type D is very similar to that of type C. To learn and grow daily like this, please do subscribe.